Hi, good evening. I'm Dr. Philip McMillan, and thank you for joining me again. And today I'm going to capture a thought, an idea that was shared by Dr. Rennebohm. And this was in a recent presentation with Geert and Dr. Shetty. And Rob made a statement at the end, or a series of statements, where he was calling to action the physician medical community to get the courage again to care. I say again because people forget what happened in the early part of the pandemic, how much sacrifice was made from the clinical perspective by doctors, nurses, healthcares facing the pandemic without the knowledge of what was going on and losing colleagues, losing lives of colleagues, being afraid but still going to work. Now, something happened in the pandemic, and I'm going to address that just after hearing what Rob had to say. But I think that his perspective and his call to action to doctors really stands out as he comes to tears in this presentation, in this short clip. And take a listen, and we'll come back afterwards.
Well, one thought that occurs to me is we need to mobilize physicians en masse as a large group. Physicians have been very passive in accepting the prevailing narrative and the prevailing recommendations because they've apparently trusted those as being wise and scientific. And the result has been that they haven't taken Geert's work seriously, for example. They have scoffed at use of ivermectin, hydroxychloroquine, without critically examining whether that is justified. But there's been a very passive acceptance of not embracing the understandings and the actions that should emanate from those understandings. So I would like to challenge the medical profession itself, particularly the physicians, to, and I'm talking about the vast majority of physicians that are in private practice or in academic medicine, and ask them to please sorry. They need to resume their critical thinking, their compassion for their patients, and their courage and their hard work to figure out how they can help end this pandemic the way it should be ended.
Powerful words, and something that it touched me at the time. And as I said, Dr. Rennebohm had really worked hard to try and bring these clinical concepts across. And I just want people to remember again, because the vast majority of healthcare people, doctors, nurses, really care about their patients. Don't forget what they did. They really went to the limits of their capabilities in the pandemic. They risked their lives and they were afraid. Now, what I think has happened subsequently, and this is where I'm just sharing a few ideas here. I think that what happened at about a point of June of 2020, the creative ideas started to flow. And that's when the first mentions were made of things like hydroxychloroquine, ivermectin, dexamethasone. And there was hope that we could find solutions. But very quickly, that hope was shut down. It was made very clear that this kind of thinking was no longer appreciated. There were solutions that were coming. There were vaccines. There were antivirals. There were things that could make big pharmaceutical companies lots of money. This no longer became finding solutions to save the lives of patients. I think that doctors went back into their shells and accepted the protocols and followed the rules instead of continuing to be creative. When we think of what Dr. Shetty did in South Africa, minimal resources, limited access to hospitals in semi rural South Africa, and just by creativity, innovation, trying to understand the disease, he saved the life of almost every patient he had to handle in his community. In times past, that kind of ingenuity and work would have been celebrated. But once we had a situation where big investment and funds could be impacted, it seemed as though for the clinical work, everybody needed to go back into their shells, follow the instructions, follow the protocols, because they know better. It has led us to a point in the pandemic where this is truly a disastrous situation. We are on the brink of probably what could be a very frightening reality for most people. We have virus circulating freely in a situation where the vast majorities of the population are immune primed. The implications are quite serious. It's a time again to call those creative doctors, come back out of your shells. Remember what it was like at the beginning. Remember the sacrifices that were made, because it will possibly come at a cost. Because challenging these systems is not going to be easy, but it has to be done together. Just as Rob had highlighted, en masse, physicians, doctors, nurses, let's get back to research, finding answers, saving lives. That's what the vast majority of doctors do every day. They just need to find that courage to care again. But it can be done, and the world desperately needs them to be there. Have a good evening.